Good morning and welcome to this week's episode of Feedback Friday. Today we're joined by the Vihiga County NCD Non-Communicable Diseases Coordinator Mike Endovo, who will be talking to us a bit about what NCDs are and answering some of the questions you've asked on NCDs. Now, one of the majorly and key NCDs that we often know is diabetes, but there are a bit more to this particular segment than just diabetes. So Mike will be telling us about that and answering questions that have been raised by your audiences. We continue encouraging you, please ask your questions in the comment section and we'll be getting experts to answer the questions for you. So Karibu, Mike, it's good
Asante.
to have you today. You're
Thank you.
the Non-Communicable Diseases Coordinator in Vihiga County.
Yes.
Can you tell us a bit about yourself and what does an NCD coordinator do? What does that entail?
Okay. Thank you so much for this. Yes, as you said, I'm Mike Endovo, the county NCD coordinator, Vihiga County, and my work is just to oversee these non-communicable diseases across the county of Vihiga and maybe link from the facility to the department and even to the national government on matters NCDs.
Okay.
Yeah.
And we often, as I mentioned, we often only know diabetes as one of the NCDs.
Yeah.
What are the other non-communicable diseases that we have?
Yeah, there are so many non-communicable diseases, but the main ones that are the hypertension and diabetes. But now we have like the sickle cell, which mostly affect the children. We have accidents and trauma. Also, that these are NCDs because basically, in simple terms, NCDs are those diseases that cannot be transmitted from one person to another.
Okay.
Yeah, those are the basic understanding of it. Because we had like the communicable diseases like TB and HIV and AIDS, those are come in contact when people meet or someone can transmit from one person to another. But when you talk about non-communicable, is when now we have the disease that cannot be transmitted from one person to another.
Okay. And how do you conduct screening of these non-communicable diseases?
Yes, now they are targeted, and each NCD has its own mode or way of being screened. But in simple terms, we start by history. When you take history from a patient or a person, then we'll be able to know maybe if he or she has these NCDs. Like for hypertension, we do the blood pressure checker. You measure the blood pressure, and we have the normal values or ranges which you work with, which you've trained even our CHPs on how to know whether these are within normal parameters or they're above, and maybe what they need to do when the parameters are above the normal. For diabetes, we do the blood sugar check, which also we empowered people, be it the healthcare workers and even self-patients who have these conditions also know. For the sickle cell, we do the sickler testing test, which also will be able to tell us if this person has sickle cell or not. The traits will be able to tell us if that person is having it or not. For the kidney issues, we also have the kidney function test, which once they are above the way normal ranges, we'll be able now to tell that this person is having maybe kidney disease, and we need to advise whether to start dialysis or maybe to start with the lifestyle modification and all that.
Okay.
Yeah.
And speaking of the CHPs,
Yes.
the community health promoters
Promoters.
in Vihiga County have
Yes.
been recognized as to be doing very well.
Yeah.
However, some of the issues that have been raised at the community level is oftentimes the glucometer, BP machines have either out of service glucose sticks or lack batteries, and therefore, linking that back to the community, since they're the ones who are able to identify some of these cases and refer to the facility, it becomes a bit of a challenge. So how do you address some of these issues to ensure that the CHPs also are able to get the right tools to ensure that they conduct relevant referrals and are able to assist people from the community?
Yeah, thank you so much. And I would like to appreciate first the county government of Viga and Department of Health in collaboration with the national government. They gave CHPs a kit that has blood pressure machine and it has glucometers, which are used to to test sugars. But the main challenge we've been having is at times when these things are being bought, there is not that clear consultation, because now you'll find that the strips or the glucometers that have been bought, now we have a challenge of getting the strips. Maybe you will find some are imported, and now locally we find it. Now it's a challenge to have them. So that's the challenge we have been having with the CHPs and through the community focal person at the department. You find these CHPs were given strips and glucometers. One, they had some short expiry, so majority of them maybe expired without being maybe used. Two, these CHPs are linked to facilities. So I agree there was that the link between the facilities that are linked to and the CHP or the community health assistant who is working in that area. If we could have that collaboration in a way that this CHP could allow maybe the screen at community level, we have dispensaries, we have also health centers. If that machine could also be placed maybe at the facility level also for sustainability, it could be nice if when the strips are over, that continuity could be there, because now the facility could be able now maybe to help in purchasing maybe the strips and all that. We could not be having this issue of maybe there are no strips in this facility or all that if there was that good linkage. But as we speak now, we've gathered with them and we've linked them with the facility in charges, and now they are able to know which strips they are using so that it will be able to inform them if they wait for the supply from maybe the national government or the county government. We can the services CHPs and the facility in charges linking and maybe having that working relationship of getting some strips or glucometers to ensure that the continuity of services are going on. Also applies to BP machines, so that once, because you know they are doing the test for free, but at the end of the day, we'll need some cash to get those things or to be bought. So if we can have that good adhesive collaboration, we'll be able to have this clinic continuity and not having it today. Maybe after 3 months also, we don't have those tests going on.
Okay.
Yeah.
And so, apart from this linkage between the facility and the community health promoters,
Yes.
to ensure that these issues with BP machines
Yeah.
and glucometer and other testing tools do not happen. Tusaidie wananchi.
Yes.
What are some of the other initiatives that you have in place on the ground that ensure that NCD screening is conducted well and we are able to refer people to get help as early as possible?
The first thing we've invested in is trainings and updates on healthcare workers and the CHPs, whereby they should ensure they have the current knowledge as per the guidelines that have been developed by national government in collaboration with the county government and even globally, so that we have a standardized care of this patient. For instance, a patient going to Hamisi sub-county hospital should receive the care when he or she is in the hands of the clinician or a healthcare worker in Hamisi or Emuhaya. That's the first goal we've done it and ensure it is being done and in a correct way. So this continued, and the CHPs in that area and even the nutrition department and everyone, they go in like a market center, like say a market looking at is the cancer. In the county government and even the department. So we encourage they go and screen. For ladies, they do the prostate cancer. For men, we also encourage the prostate cancer. These are the things that if we identify them as early referral system. Yes.
Thank you. And one of the other issues that we level facilities,
Yes.
a bit lower level facilities, and sometimes even sub-county hospitals, that there is often lack of
Yeah. That one I'll agree with you. And certain facilities cannot be able to store maybe certain medications, but it's something that we've worked and that let those drugs be at those facilities. Now, for sustainability and all that at NCD department level, we've encouraged the in charges. Now, is reimbursing facilities direct money, maybe to their accounts, and maybe they prioritize these NCD drugs. And we've given them the simplest list of in the teaching and referral facility also are there for the NCDs. And now we have also facilities like even Emuhaya sub-county and even Ipali. The facility I'm talking, I've walked in and I've seen basic NCD medications. that maybe you will find if a patient goes there, he will be able to be started on them. Then also, if there is need to referral, now they will link them to the facilities. Then there's also the challenge has also been maybe sometimes you find where we are sourced, these drugs are being sourced, at times they are also out of stock. Maybe you place and maybe we've waited for some time so that that order can come. But now I'm glad drugs of around 90 shillings. Even Kwanda or the nearest facility where she or he can go and get those medication. So the once that forecasting is done and we know where we are, then we'll be able. Then I'm glad of the Taifa Care system. So using the system, you can be able to even link maybe where you order the medications, and you'll be able to get the drugs in the right quantity and not underestimating, and also not having the overstocked drugs. And also we tether on what we basically need. You might find maybe you bring some maybe drugs and those drugs are not able to help our people at that time. Maybe ensure that these are the medications we need in our county and for our people. Basic. Once we sit down and know, we will be able to tell now, we have 2,000 patients on diabetes, we have the 5,000 patients on hypertension, and they're using these drugs. So it will inform the county pharmacist or the head of products and technologies on which we need. And we've left that to the sub-county team and the facility team so that they be themselves, they know, because they understand the dynamic of their facilities and the dynamic of maybe the burden of the patients they are seeing. Yes.
Okay, so we look forward to having this done so that at least
Yeah.
we ensure that, you know, when I go to the facility,
Yes.
even at the dispensary, and
Yeah.
as you mentioned, someone from Ochuari can
Yes.
easily access drugs from the area they're in.
Yes.
And one of the other key facilities we have in our county is the NCD clinic.
Yes.
Can you tell us a bit more about the NCD clinic, and why was it important for Vihiga County to have a dedicated NCD clinic?
What I'll tell you is that comes to the partner when he comes and says, I want to invest maybe in cancer. So once they go to the patients are being seen, but maybe there is inadequate space for this. Can we have a? We don't want this patient to get lost on follow-up. We want them the continuity of care going to MTRH and coming from a low income the reagents so that you let it not that we start it now and maybe we did survey in Eldoret, they charge around 3,500, and in Kisumu they charge 2,500. But because of the need of our people and the burden, we ensured that maybe we do it at 1,500, which is at least a common figure that can help them.
Okay.
Yeah.
Thank you for that. We
Yeah.
will take a short break, and when we come back, the NCD coordinator, Vihiga County, Mike, will be telling us if the dialysis machines are working, what is in Vihiga County. And yesterday we celebrated World Welcome back to this week's episode of Feedback Friday. And today we are speaking to the NCD coordinator, Mike Endovo, who's telling us a bit more about NCDs. And in the first half, we've talked about some of the key NCDs that the county deals with. And he's mentioned that there's a sickle cell test that's done at the NCD clinic in Hamisi sub-county. So in case you know someone who needs to take that, kindly share that information with them. And in the second half, we will begin with a critical question that has been asked by almost every week or so. We receive this question: are the dialysis machines working?
Yes, I can confirm, yes, the dialysis machines are working and even weekends. We have patients who are being dialyzed even on Saturday. Yeah, there's some time back we had hiccups of the machines with the maintenance and also servicing, but that one was sorted, and now our patients are able to receive dialysis services at the referral. Yeah,
Okay.
yes.
And dialysis machines are for kidney health, and it's important for us to mark these days. And I know there's always a in the year and among other days within now the NCD calendar. What's
Yeah.
the relevance of these days to the people of Vihiga?
Yeah, these days were made just to ensure that we create awareness and maybe have the success stories. I'll link it or I'll take you a little bit to the HIV and AIDS because that's where we mostly learn. Because those were the diseases that were being looked at as the monsters. But now the globally and even at national level, Kenya and even county, we've been able to manage, especially the HIV and AIDS. It's been able to manage it very well. And now you can see people can come on television and say, yes, I've been having HIV and AIDS for the last 20 years and all that. But these NCDs also, people, we had neglected them. And they have come and looked for us and we now have them and we work with them. So the reason why we have this commemoration of days is just to create awareness. That's the most important thing. Let people know that during these days we commemorate them. Like yesterday, the World Kidney Day. Let's have someone who has undergone the dialysis and has a success story to ensure that maybe he shares his journey or her journey and tells us maybe how the journey has been since the diagnosis up to where he or she is at that particular time. That will help us. Maybe there is someone who is having this condition somewhere or a family that is struggling to have that condition, but they're in stigma. But once they hear that, yes, there's this Mike who has been having this condition, but now there is this success that he's speaking about in all television, even in vernacular and everything, now they'll be able to get that initiative and come and open up and ensure that they have that condition. Then maybe during the screening, we might be able to get, during that screening time, we might be able to get someone who is having that condition and maybe he has never done it. I'll give you a typical example. When we were celebrating the World Diabetes Day in November 14th last year, we screened the county staffs and yeah, we found out that there are people having high blood pressure readings and they have never tested it, or they have been never gone to the facility just to get tested. Why? Because of the nature of the work we have. Many people come in the offices in the morning and they leave maybe in the evening, so they don't have even time for themselves just to go and have that checkup being done. So in encourage being done at that level. So that's why you have those days just to spread these heroes who are in this condition and even go much further and get, if we can see, have those, ensure that we are prevent these complications, because they say prevention is better than cure. So if we can prevent these conditions, then we'll be able to have minimal complications coming out of this. Yeah.
And now, from your interactions with the communities,
Yes.
the healthcare workers, and the different facilities you've mentioned,
Mm.
what is the level of awareness of NCDs in Vihiga County?
Yeah, I can say the level of awareness is still low. I can't say we are at where we are supposed to be. It's still low, and that's because maybe that's because of the challenges we've been having with testing kits and all that. Because I remember sometime in 2018 when we marked the World Diabetes Day nationally in Vihiga. His Excellency the Governor ordered, one of these executive orders was that we ensure all facilities are doing the blood sugar test for free. And if you look at most of under that period, that is 2018 to around 2021 there, we had a lot of patients who were diagnosed with diabetes, because we find these people are in the villages, but they have that attitude that if I go to hospital, maybe I'll not be able to get the testing strips, or maybe I'll not be able to get tested, or there are no medications in that facility. No, what I can say is that once you go to the facility and you are tested, they also refer you maybe where there are medications and all that. But we still have to strengthen our referral system, whereby we ensure end to end this patient, if he's in a health center or a dispensary, we should have that mechanism to ensure that when I refer this patient, he really arrived at the facility I had referred him. Then we do with the maternity, whereby if we refer a mother from a miss who is pregnant, we follow up, maybe the mother arrived at VCRH and maybe the cesarean section was done and the baby is doing well, or there's something that came up with in between, and this feedback that is being done. So many patients are lost on follow-up or are lost on the referral path. So once we strengthen that referral path, we will be able to, the awareness will be able to go up and scale up. And then also through interviews like these ones, and also maybe radio shows, whereby we have these topics being talked about more frequently, so that our people can be able to know, yes, if I go maybe to this facility, I'll be able to get this test. If I go to this facility, I'll be able to get this test. And once all those things are being done, then the level of awareness will go up. Because even among the healthcare workers and even the elite group, there's still low awareness on this, and that's why there is also that fear of going to do, maybe even being screened for cervical cancer. If you ask, even the most people who don't go for these tests are even the healthcare workers themselves, or even the county staff themselves. They fear maybe I'm told I'm having maybe cervical cancer, or then now this thing is very expensive, it will drain me and all that. So people fear, and by the time they come for that checkup, now finally
You should do yearly checkups.
yes.
So you can go yearly,
Yeah.
and just apart from utapata kile unatafuta. So we see a lot of people often fear that
This first, the CHPs, if each CHP is if there is that good relationship between healthcare worker and the CHPs, now we'll be able to there's, I can't tell you that way. First we'll have that interaction, I counsel you and guide you, and maybe you'll also start opening have that, because if the CHP will identify, then link to healthcare worker, because I can confirm up to the some dispensary level, the healthcare workers, they have been trained on basic screening of maybe cervical cancer. The CHPs also have the knowledge on how to take history and tell us, yes, this patient I'm querying, he or she might be having maybe this type of cancer. So I need to refer maybe to a high level facility, so that I can be able to get that treatment, or I can be able to get more screening. And if that facility also goes there, then the other healthcare worker or person in that facility will be able to refer to the maybe next level facility. So the most important here is the strengthening of the referral system. Once you've empowered people with the knowledge, now you'll find that CHP will tell you, I have a patient who has now diabetes. Where will I send this patient? I have a patient who has sickle cell, because they don't have the identification of the facility whereby this patient will receive the treatment. So, as per now, through the sub-county medical officers of health, we've informed them that the facilities that within their sub-county, that offer these services. So maybe during their forums, their community engagement forums, hospital board meetings, sub-county health management meetings and all that, they spend only 5 minutes just to share the information. Yes, we have this being done at this facility, and if you have a patient, you can refer this patient to this facility so that those patients can be able. The challenge is when a patient comes and he doesn't get that service at that place, now he or she lose trust. So she'll say no, they even don't do it, so I'll just waste my transport and all that. But once we assure, the way I've said that, like the dialysis machine is being the dialysis is being done at VCRH. Now patient if comes tomorrow or comes on Monday, he will be told yes, it is being done, but you need to do this test or this test, then come Wednesday for the services now for maybe dialysis. So the information is the most important thing.
Okay.
Yeah.
So it's also key for how the CHP is
Yes.
linking to the community
Yeah.
when they come to to me
Yeah.
at the community level.
Yes.
To pass the information
Yeah.
in a nice way,
Yes.
so that
As per last week, they had screened 10,000 women in Amisi. The 10,000, more than 10,000 women. It's because of the CHPs, because they understand the dynamics. And because me, I cannot go in Amisi, where maybe I don't come from and all that, and start telling the people, I want to do cancer screening in this area. No, first I to involve the chiefs through their barazas. I involve the CHPs through their community forums, engagements, and all the healthcare workers in that area, because they tend to have a very good bond and relationship with this patient than me, Mike, who will go there for the first time and maybe start creating now that bondage. But I can chip in now maybe technically during the forums now, whereby they are mobilized and done everything possible.
okay.
Yeah.
And just as a follow up to what you've mentioned and
Yes.
the initiatives at the community,
Yeah.
last year we had a resident who there was a change in diabetes children
Yeah.
project
Yeah.
meeting that was done in June last year.
Yes.
And one of the questions we received from that is how does the health department communicate such meetings to persons now at the community level?
Good. Yeah, there's that project that has been in Vihiga for quite some time called Changing Diabetes in Children. And it has really helped us so much because we started it in 2018 with only 2 children. But now, as I speak here today, we have over 100 children on that program from Viga alone. And they have been helped in Hamisi and in the referral facility. How we do this is through the CHPs. We've informed them through the community strategical focal person that let any person or any individual who is having diabetes, specifically for the children, know that there is a program that is cutting for their drugs for free, their glucometers for free, and even some have also been paid school fees. Those who performed very, very well, they have been helped to get maybe school fees, and so that they can achieve their goals. So we do that through the CHPs and the community people, the community health assistant, the CHAS, and even the sub-county medical officers of health, who we believe they are at the grassroots of these people, and help them do that. And through the forums that you say, like the one we had June last year, we do it and ensure that it goes to public so that they know these things are being done at our local facilities, whereby they can be screened and also be referred and linked to the higher facilities where they can receive the commodities at zero cost.
Okay.
Yeah.
And now for instance, for this particular resident
Yeah.
who did not get a chance to learn about this meeting
Yes.
and was not able to maybe benefit from
Yeah.
the conversations that
Yes.
happened at that particular meeting and others.
Yeah. Yes.
Where do I find you, or who do I talk to answer these questions that often are raised from different households?
That's good. First, I'll encourage the individuals to know where the CHPs come from at the community level. Then the CHP has basic knowledge on NCDs. All the CHPs in the Viga account, they have been taken through the module, the simplest at their level of care. They can do the test and they can do the blood pressure check. Then they refer. Then they refer to the linked facilities, be it a dispensary or a health center. Some CHPs can also call, some reach out to me directly for those who know me. And we have also the sub-county NC. Majority of them, I can say close to 60 to 70%, have been taken through the NCD training, so they can be able to tell. And if they cannot be able to manage that patient at that level, they can reach out to us so that to ensure that they get it. I'd give an example of like Emuhaya. They have a physician, they have a gynecologist, they have all specialists in that facility. So I believe that those people coming from Emuhaya, they can be able to get those services, and basic have a physician who is there, whom they could struggle some years back to come and see this physician at the referral hospital. And we only had one who could see all these patients. And you understand there is that also burnout. One person cannot serve all bigger residents of over 600,000 people. But now we have one in Emuhaya to ease that burden, who is also mentoring people from the sub-county, respective sub-county, in health facilities there. Then we have a physician also goes to Hamisi sub-county hospital, so that to cut costs and expenses of those patients coming from Hamisi to the referral facilities for checkup. So it's easier to get a physician going to Hamisi than getting 20 patients coming to the referral hospital, and those 20 patients can be seen there. It also happens in Sabatia, whereby also we've had a model of this physician who will be going to Sabatia also to help them run their NCD clinic, so that those patients can be seen at the nearest point of care to ensure that they receive the care that they could have received when in the hands of the healthcare worker in the referral facility.
Okay.
Yes.
And as we conclude, we'd like to also know, what are some of the key milestones that have been achieved within NCD in Vihiga County? What are some of the key projects that are ongoing? And, when you talk about NCD, what do you say we are most proud of having achieved this thing? And what are some of the upcoming projects we should look out for?
Yes, first and foremost is the NCD clinic in Hamisi. It has really been a game changer in the NCD world in Vihiga and even the national level. It has been recognized, and all the services have been offered there. Another thing that I can say we've achieved is through the NCD clinic in Hamisi, UNICEF have come on board, which are coming to help us in NCDs in children, whereby we ensure that these children also are screened and being taken care of. And that collaboration has come up with something that has not also been there. We work in relation with the Department of Education, so that we ensure that even teachers are bringing them on board, because at the end of the day, they take care of these children in schools. So we ensure that they come and help us in ensuring that these NCDs are being done and being screened even in school level. We have these children with the sickle cell, mental illness in schools, the physically challenged. So we brought in the director of education, the TSC director. We involve them in our meetings. Even we've initiated technical working groups for NCDs, and also the member of the county assembly, because at the end of the day, they're the ones who passes budget and all that. We've raised advocacy to them so that they can ensure when we say we need more allocation on NCDs, then they get to know why we need it. So they're also on board, and we work with them in this journey. And I'm proudly sitting here saying that we had that conversation with the members of the county assembly. We sat down as a department and NCD space and talked to them and told them, yeah, MCS, these people are your residents. So they agreed, and we mobilized, and they agreed that each MCA has selected one facility in his or her ward. The 25 wards we have in Vihiga, each MCA has selected one facility that he has specifically dedicated a budget to buy NCD commodities, only for NCD commodities. So each and every ward is for a pilot beginning. So each ward has a facility, and we assess the facility as a high volume facility. Then we've looked at the basic drugs that are needed, and it's going to help us, your initial question, that how will we ensure that the sustainability of NCD commodities are not out of stock. These drugs will come, and they will help our people at their doorsteps, whereby they come from. So if we have a ward, because Vihiga has, the wards are not that big, but if a patient can be able to identify a central facility in the ward, then if that patient goes there and can be able to get the diabetes drug, hypertension drugs, then we are good to go. So they have confirmed that, and it's been put in the budget, and in in the course of this month, those dogs will be delivered to the selected facilities. And now the focus now will be the sub-county hospitals and the referral hospital. Now this will help us now, the drugs that could have gone also to the maybe lower facilities, now it will have to reduce and maybe empower more sub-county hospitals and the referral facility. So now those NCD communities now will be there. So it will be a very good thing, and I thank the members of the County Assembly and also His Excellency the Governor and the Department of Health for that initiative when we did that proposal, and they received it positively. So how can we add us more? And if they see it is justifiable, now we'll be able this space will be able to be very perfect and run smoothly. Yeah.
And
Then the aspect of now it's now going to be ongoing, and now we'll be able to tell which quantity do we need for this quarter so that we can ensure that NCD commodities are available in our facilities.
Yes,
Yeah.
thank you for that. And you've mentioned funding is also one of the key issues within,
Yeah.
especially within running the projects
Yes.
and the services that you provide.
Yeah.
Now, what are some of the other avenues beyond what you've mentioned? How do you ensure that NCD projects continue running despite not having adequate funding or budget allocations?
Yes, now we rely on donors. Like aspect of, we have the World Diabetes Foundation in Vihiga. What we always tell our partners is that one company building us with knowledge on NCDs and updates. We welcome them, and NCDs, we do what? We pick it, and maybe we see where need is, and we supply them to those facilities. Yeah. And I've seen some facilities also whereby they pull patients together and they tell patients, yes, instead of maybe buying these drugs alone, we can pull this money and put it together, and then facility can order for you at a subsidized price. Then you can pick those drugs. I've tried these NCDs so that you can prevent these complications. It's so sad to see an elder mama or an elder man coming to the facility with a wound that could have been prevented earlier on, and we are doing amputation. Then I encourage them also to get the social insurance cover. It helps them. However much people will talk about it in a negative way or so, but I encourage. I've seen patients who've benefited from it, because you'll find that maybe there are some expensive tests that might not be able to be paid by cash because of the setting you are in. But once we have that social insurance cover, we'll be able to do those tests. Even if it's not bigger, even if you go to Kakamega or Kisumu, we'll be able to do like a CT scan so that we can not chip so much in pocket wise, so that to get those tests being done. So once if we can be able to have it, it will help us so much. Then to the department, the county government, we are going to have wellness checkups, whereby we would wish to be screening even the county workers at even the sub-county level and the county level, to ensure that they are being checked, even if it's on weekly basis or even after every 2 weeks, just to check their sugar levels and maybe their pressure, the blood pressure checkup. Once we get it, maybe we link them to the nearest facilities whereby they should ensure that they get treatment and also do the prompt referral. So when called upon, or when you see healthcare workers maybe having tents in the field and doing that, come out in large numbers so that you can be tested and be checked out, so that we can have this NCDs being something of maybe of the past, and preventive measures that should be put in place. Thank you so much.
Thank you to everyone for joining us today, and thank you to Mike Endovo for joining us. He's the NCD coordinator,
Yeah.
Vihiga County. We hope you've learned a bit more about, non-communicable diseases beyond the ones that we often talk about, and have had some of the questions that you've raised answered today. Continue joining us every Friday for Feedback Friday, where we get experts to answer questions that that have been raised from your audiences. And this production is brought to you by the Department of Communication. We look forward to you joining us next week. We'll be speaking to the Director of Revenue, who will be telling us a bit more about that. So thank you again for joining us. I've been your host, Shamim Kerai Hussein. Until next time, bye.